A patient type that we'll see in here on a daily basis is the diabetic patient. This is one of my special concerns, with the goal being to prevent amputation, one of the extreme risk factors for diabetes. Many diabetics won't end up in this category with the amputation if they're following simple things like controlling their sugar and following up with their doctor. It's the patients that don't manage their diabetes, their sugars are out of control, they're not seeing their primary care physician, and they don't see a podiatrist that end up with the toe amputations or foot amputations down the road. Some of the risk factors that go along with diabetes that can be associated with it are vascular disease. We'll see patients that have diminished pulses on an exam. And one of the factors that can lead to amputation in a diabetic, and the most common factor, would be loss of sensation. When we see a diabetic patient, we will perform a diabetic foot exam that includes an evaluation of their perception of sensation, as well as looking at their pulses. Often when the circulation looks diminished on an exam, we can follow that up with a more detailed test known as an ABI, or ankle brachial index. This gives a readout on a computer and can give us a quantification or a number of how bad the circulation really is. If a patient has loss of sensation and we know they're a higher risk, we'll take a more preventative watch for them, as having them back on a more frequent basis and making sure that they have something like diabetic shoes. A question I'll get from a lot of diabetics is, do they need shoes? And the answer is, not every diabetic needs a diabetic shoe. There are many diabetics with healthy feet, no foot deformities, their sensation's intact, their circulation's intact. But those that do require them, we make sure that either we can get them or we find somebody that can fit them for the shoes. The importance in the heart of keeping your risk down at a lower level comes back to sugar control. It's the same thing for the eyes, the kidneys, as well as the feet. If they're doing a good job of keeping their sugars under control, they should be able to halt the other problems that are associated with diabetes.